everyone, this is Dr. 𝒊𝒏𝒇𝒐𝒓𝒎𝒂𝒕𝒊𝒐𝒏, Senior Consultant Neurophysician at Prasad Hospital, Nacharam. So today I am going to tell you what are all the diseases which a neurologist will be treating. So starting with the brain. So the most common neurological disorder where the patient comes is a headache. So among the different types of headache, we commonly treat migraine headache and tension headache. And the next neurological disorder is the stroke, also called brain attack. And the other neurological disorder of the brain is the seizures, which are also called fits. And there will be some movement disorders like Parkinson's disease and also dementia, which is the most common dementia is Alzheimer's dementia, and also infections of the brain, which is also called meningitis or encephalitis. And there are also some other neurological problems associated with brain damage, like the patient can present with facial palsy and also vertigo or giddiness. Leaving the brain, the neurologist will also treat the diseases associated with spinal cord, like secondary to trauma, and also degenerative spine disease like cervical spondylosis and lumbar spondylosis. And when the patient has lumbar spondylosis, majority of the time the patients present with a symptom known as sciatica. Leaving the spine, the next nervous system which is involved will be the nerves. So when the patient gets involved, diseases involving the nerves, the patient can have peripheral neuropathy or facial palsy. So following the nerves, there will be disorders affecting the neuromuscular junction, commonly known as Myasthenia Gravis. And now the last would be the muscle disorders, where the patient will have myopathy or muscular dystrophies, which are congenital anomalies. After knowing the different neurological disorders, what are the different symptoms or the manifestations where the patients need to present themselves to the neurologist. So coming to the different manifestations, like if the patient comes with a stroke, the patient can have facial asymmetry, arm weakness or the arm drift. Patient can have speech disturbances. At the same time, patient can have blindness or double vision and giddiness. At the same time, the patient presents with seizures, also called fits. So majority of the times we can see outside the patient getting seizures associated with loss of consciousness and the fall down. And coming to the headache. So the most common headache which we see in our routine practice is migraine headache, where the patients will have single-sided headache associated with phobia to the light, phobia to the sounds, and can have nausea and giddiness or reeling sensation. And the next common headache is tension headache. And then the other symptoms are when the patient have infection of the brain, that is called meningitis or encephalitis. Patients will have fever with altered sensorium and can have seizures also. And the other symptoms are when there are associated movement disorders like Parkinson's disease, the patients can have rigidity or stiffness of the body and also slowness of activities and also tremors, and can have postural instability with recurrent falls. And the last symptoms where there will be involvement of the brain is called dementia. So these dementia where the patients, especially in elderly people, will have memory disturbances and at the same time can have behavioral disturbances. So these are the symptoms where it correlates to the neurological disorder involving the brain. So next comes is the involvement of the spinal cord. So if a patient has some disorder involving the spinal cord, they can have neck pain, back pain, and this neck pain can be radiating to the right hand or the left hand. At the same time, the patient can have backache, and this backache can be radiating to the right leg or the left leg. And then coming to the next symptoms involving the nervous system and the neuromuscular junction. So if the patient gets in symptoms related to the nerves, then the patient can have numbness or tingling sensation or burning sensation of the feet. These can be mainly seen in long-standing diabetic patients and the patients who have alcohol abuse. And next comes the neuromuscular junction disorders, that is Myasthenia Gravis, where the patients typically present with early morning they will be absolutely fine, and as the day progresses they will have drooping of the eyelids and also fatigue, and the patient gets easily tired up and unable to do the activities. And the last but not the least is the muscle disorders, where the patient suffering with the muscle disorders will have muscle weakness, and at the same time there can be swelling of the muscles, or at the same time there will be wasting of the muscles or thinning of the muscles. And we neurologists also treat head injuries if they are managed conservatively, and also brain tumors when the patients present with severe headache and also associated with seizures. And the last one is the neurological disorder also known as facial palsy, where the patient presents with deviation of the mouth, unable to close the eye, drooping of the eyelid, and also drooling of the saliva from the angle of the mouth. And the last neurological symptom is vertigo or giddiness, where the patients will have reeling sensation of the giddiness, like they themselves are rotating or the surroundings are revolving around them, associated with some cooing sound in the ear, that is called tinnitus, or even sometimes associated with hearing loss or ear fullness. This is called vertigo, and in case of vertigo we need to rule out the peripheral or central vertigo. So when you have these symptoms as mentioned above, so you need to immediately go to your concerned neurologist to rule out your neurological disorder. Thank you.